Hi, I'm Dr. James Wallace. I'm a consultant in emergency medicine and the Trust Research Leader at Warrington and Halton Hospitals. The research that I've recently had published was around inappropriate CPR at the end of life. This was a project looking at a whole year's worth of patients that came into A&E that were unfortunately in cardiac arrest or subsequently had a cardiac arrest, and looking at whether those patients could have had a predictable cardiac arrest and whether they actually should have had CPR pressing on the chest or not. This information has been shared not only locally but regionally and in fact internationally, published in Resuscitation and BMJ Supportive Care. The idea of this information is part of a Paramedic Masters project to try and increase the awareness of things that can be done to predict when patients are at the end of life, to prevent them having inappropriate CPR and inappropriate and sometimes painful procedures which are not beneficial for them or their family. Previous work that I've had published was with the European Society of Emergency Medicine, of which I am a committee member, was a journal that was published late last year with Springer called the European Journal of Geriatric Emergency Medicine. I published with a fellow author called Eric Review, who's a French emergency medicine consultant in Chartres in France, who's also the lead for the pre-hospital service. The journal was a collaboration of multiple international authors. The chapter that I helped co-author was on the pre-hospital emergency management of geriatric emergency medicine patients. This was looking at patients in the pre-hospital field who are older, and also what things we can do to recognise that their needs in healthcare environments, and also what things we can do to prevent them from coming in. I feel that getting published, either an abstract, a full journal, part of a meta-analysis, or even as a book or a textbook, is beneficial not only to the individual but also the trust you work in. I always feel that if you're going to make good changes in your department or hospital, why not share it not only with your colleagues but with the wider community? I feel that by doing this research, it hones what you do to make sure that the way that you write it up and complete it and produce it is made to be of a high standard, but also it puts our name on the map, that the hospital you're working in actually generates all this information, is making change, and why not let other colleagues benefit from the studies that you've done. The advice that I would give to anyone that wants to be published, be it in a journal, be it at a conference, or even in a textbook, is to just give it a go. You need to think about what data you're providing, make sure it's of a high standard, and look at what has been published to ensure that the way that you're writing it has clear objectives, clear methods, and a clear aim, and also a clear way of understanding what difference you've made. I think I would personally recommend looking at conferences either locally or nationally to see how you can get the abstract published and get your confidence up at talking in front of other people, but also having the peers in the audience ask you pertinent questions you don't know until you've done it. Currently, we're involved in one emergency medicine research project, which is an international research project looking at new medications being brought from Australasia as a form of advanced pain relief in the emergency department. We've recruited nearly several hundred patients over the last year, looking to recruit quite a bit more as part of an international study. There's also another study that hopefully will start later on this year, looking at the indications for CT in headaches and subarachnoid hemorrhages. It's very early days, and we're working with the TURN group, which is a group of emergency medicine research people across the UK.